Welcome. I'm here to welcome you and introduce our great speakers for this webinar today. I am Amy Tepp, and I am the partner who oversees our revenue cycle services here at Eide Bailly. And within revenue cycle, compliance within healthcare also fits within that segment of our business. So today we're going to hear from Rachel Pugliano and Jessica Assen. Rachel has over 20 years of experience within the revenue cycle and compliance. She primarily spends most of her time within the coding and documentation area, as well as compliance services for our healthcare clients, primarily working with, program effectiveness, program, assessment, as well as kind of an extension of some organizations' compliance programs, helping them out with audit plans and risk assessments, which you're going to hear more of today. And we're also going to hear from Jessica Assen, who has 15 years of experience. She's a registered nurse and works in our healthcare practice as well. She spends a lot of her time working with our long-term care clients, as well as those in our assisted living setting. She also works with supporting individuals with intellectual and developmental disabilities. She helps clients with training, doing for survey preparedness, policy and procedure development and implementation, as well as staff training and analysis and development, and the clinical side of EHR implementations. And she's involved with organizations such as the American Nurses Association, as well as the American Association of Post-Acute Care Nursing. So moving on to the next slide, this is just going to be kind of what the flow of this webinar will be. First, we're going to talk about the elements of an effective compliance program. We're going to also go through what the risk assessment process is and what that might look like for you within your organization, and how you can use that to establish your work plan for the next year. And then how do we determine if our compliance program is effective or not? And then we're going to go into what things within the OIG work plan pertain to the senior living industry that you might want to be aware of as you're going through your own compliance program work plan for the upcoming year, and then some other compliance topics. And with that, I'm going to turn it over to Rachel Pugliano, who will be talking about the essential elements of an effective compliance program.
All right, good afternoon, everyone. Thanks for joining us today. So I'm going to start by getting us here. There we go. Whoops. There we go. Just kind of going through those essential elements of the program, of a compliance program, and then I'll touch in depth on each one of these as we move through the presentation. But the OIG has put together what they consider the 7 key elements of an effective compliance program. You'll see that there are 8 bullet points on this slide, and there's kind of an unofficial 8th element that includes the assessment of the effectiveness of your program. So we'll talk about that as well. But to start with, the first element is having the compliance program structure and the governance and the administration of that program in place. Having written standards, policies, procedures, your code of conduct, all of those documents in writing. Having screening mechanisms in place for your employees, for vendors, for providers. And then the communication with all of the employees on the expectations around compliance, the compliance program elements, how to report concerns. So all of that communication pieces as part of the program, along with education and training provided to both providers, employees, even the board. Auditing and monitoring, which that speaks to ongoing audits that are done internally, monitoring as follow-up of those audits. Sometimes there might be external audits that are performed. So we'll get into a lot of what those different things might look like. published and communicated disciplinary guidelines and standards for the organization, the corrective actions that are taken once an issue is discovered. So what is being done as a result of finding an issue, and what are we going to do to make sure that it doesn't happen again? And then lastly, assessing the effectiveness of the program. So just to start with compliance program structure. So what the OIG wants to see is a compliance officer in place and named at the organization. And this individual is going to be responsible for implementing and maintaining the compliance program. And they're also going to be the key individual that's involved with resolving compliance issues. Now, that doesn't necessarily mean that the compliance officer performs all of the resolution. There might be individuals within the organization that have specific expertise that need to be brought into the situation, and then their knowledge is used to help resolve the issue as well. But it's really on the compliance officer's shoulders to ultimately know what that resolution is and really kind of steering that ship. The compliance officer also oversees any investigations or corrective actions that are put in place. So if there's an outside agency that comes in to perform an investigation, the compliance officer definitely needs to be a part of that conversation. They need to know who's there. They need to know what the investigation is about and what that investigator is asking for. The compliance officer also needs to have been given that authority to really administer this program. And that authority comes from the leadership at the organization. In fact, it really comes from the board. So oftentimes what we see is the compliance officer may have a reporting structure to the CEO, but they have a dotted line to the board. So they can go directly to the board of directors or the board of trustees to have an open line of communication about any compliance concerns that might be occurring at the facility. So I really just talked about governance a little bit here, and that is having that compliance committee in place. So this is where that compliance officer is going to share any compliance related activity, any investigations, auditing, monitoring, what the annual work plan might look like. That's going to be reported to the compliance committee. Usually the compliance committee is made up of some board members. It may not have the entire board on that compliance committee, but the board would also receive compliance committee minutes just as being part of the board itself. And really, I just want to stress the entire culture of compliance really comes from the leadership at the organization. So that's going to be the CEO, the CFO, it's going to be the compliance committee, the board of directors. That's where that message starts, and then it starts flowing through the organization from that level. And I do want to mention that every healthcare organization is different and unique. And even the OIG has recognized that in their documents and in their communications. They don't expect every compliance program structure to look exactly the same. It's really going to vary on the structure, on the size of the organization. We understand that in smaller organizations, you may not have a compliance officer where that is their sole role. They might be responsible for an entire department, and they may have multiple hats that they wear at the organization. And so the OIG isn't looking for a one-size-fits-all program, but they would like to see something that fits the nature and the resources at that organization. And regardless of size, they want to see that that culture of compliance is present at the organization. So getting into what we have in writing and what those written standards are. So first and foremost, having a written code of conduct. And oftentimes this is shared with employees upon hire, and they sign like an attestation, so to speak, that they've read the code of conduct and that they will be adhering to that code as part of their employment at the organization. And this code of conduct training tends to happen annually, as well as upon that new employee orientation. The compliance plan itself should be in writing, specific to the organization. It should include some coding and billing aspects. There would be financial assistance policies as part of the program, the quality and patients' rights pieces to this. And I do want to mention quality as well, in that the OIG does expect that anything we do from a compliance perspective is ultimately for the benefit of the patient. Yes, this is something that we're expected to do as a healthcare organization, but end result or the end goal is to ensure that the quality of care for the patient is up to standard. The compliance plan will also typically have documented hiring practices, screenings, screening for sanctions, things of that nature. And then policies and procedures. And what is nice is that the OIG has published some listings of policies and procedures that they expect to see in place. And so oftentimes we can use that as our guide in moving through, well, what policies and procedures should we have at the organization, and ensuring that we have those in writing. So the screening portion is that expectation that upon new hire, you're going to be providing a background check upon employment. But then ongoing, we want to also provide screening for the providers, for our vendors, business partners, and we typically see that type of screening for being able to participate in the Medicare program, that happening on a monthly basis. So we want to have some sort of mechanism in place that we ensure that that screening for sanctions is part of a monthly process, and that there's an individual that is responsible and that they're funneled the information that they need, whether there's a new vendor in place or a new business partner, new hires, all of that information is then shared with that individual. Also, the education and training piece, we know that new employee orientation will typically include HIPAA training and compliance program training, code of conduct, but then what is included in the annual training? Are we reiterating our culture of compliance on an annual basis? And then what about our high risk or specialized areas? And these might be the coding and billing departments that receive some specialized training since their work is so highly tied to reimbursement. And also the board might need some specialized compliance training just because of their oversight role for the compliance program. It's important for the board to know the role that they play when it comes to really setting that stage or setting that culture for compliance at the organization. And part of this education and training is just to continue to reiterate to all employees that compliance is a part of their job. So having a piece in the job description that specifically calls out the code of conduct and adhering to compliance policies and procedures is important to have that as part of every job description at the healthcare organization, because really anyone in any role could identify a compliance concern, and they need to understand that that is part of their responsibility to report those things. So the communications, really this is identifying what are the avenues for the employee to communicate a compliance concern. Are there open lines of communication for going to the compliance officer? Does everybody know who the compliance officer is? Do they know how to contact this individual? And what about if the compliance officer isn't available? Are there other avenues that they can explore for that communication? So really keeping that open door, open line communication and having that known and felt throughout the organization. So of course, from a reporting perspective, they can go to their direct supervisor. If that's not available, or maybe that is not appropriate for whatever the concern is, having that ability to go to administration, go directly to the compliance officer. And if the individual is concerned about maybe they want to be anonymous with the reporting and with the nature of the issue that they're describing, having a hotline where they can just call, or maybe maybe there's like a secure portal type of form they can fill out and submit the compliance concern. There's a lot of vendors out there that supply this type of anonymous reporting options. And what we see is that they receive the phone call, they document the nature of the issue, get as many details as they can, and then that is communicated with the compliance officer for that investigation of the issue to then begin. And then a monthly report is also supplied to the organization of any hotline calls, what the resolution might be. So there's a documentation trail, and it's kept on file then as part of your compliance program that you're performing this work and that you have this available to the employees. So that speaks to the reporting and documentation. So continuing to have a record of any compliance concerns that have been reported. And it can vary, when people come in person to report a concern, having something even as simple as a log or a spreadsheet, something that you can log that compliance concern, document the investigation that's been around it, what the outcome of that is, and then any corrective action that would be associated with the concern. All of that documentation should be kept and filed in order to support the reporting and communication pieces of this. I think one of the areas that we probably hear the most about when it comes to compliance programs is auditing and monitoring. This tends to be the area where we find something and now we decide, okay, well, let's pull some claims, or let's look at some documentation, or let's look at some denials data and try to figure out what the issue might be. And we start going down the path of identifying a root cause, and then we go forward with ensuring that that doesn't happen again. So there's a lot of different ways that auditing and monitoring can be performed. And really kind of what I described is more of a reactive type auditing, where we discover that something wasn't working appropriately, or we were coding something wrong, or we found that there was a denial with a certain payer and we need to be doing something different with that. So that's more of fixing something on the back end, which is totally normal, and we find things like that all the time. As part of the program, we do want to have a proactive process in place where we've identified some areas of risk for the organization, and we have a plan in place from an annual perspective that throughout the year, we're going to do some auditing of these specific areas because we know that they're high risk. And we want to make sure that we're in compliance with the rules and regulations. And if we find that we're not, we're going to go ahead and make some changes and put some corrective actions in place. And then following that, we have some ongoing monitoring where maybe a couple of months after the review is conducted, we're going to pull a small sample of claims or run a report that just kind of helps us keep track on if the corrective action that we put in place is really working. So that's all part of the auditing and monitoring piece is, it's great to do an audit and find an issue, but then what did we do about it? And then how are we continuing to make sure that it's not occurring again within our organization? So really all of this helps with improvements. Sometimes it's not only a compliance improvement that you find. Sometimes it results in efficiencies, in operational improvements, process improvements. And so it's always nice to perform an audit and find that, oh, okay, well, not only will this help us be in compliance, but this is going to be a lot easier with how we're doing things. And we've identified this gap and now we have a fix in place. Also, we want to provide or document accountability for the auditing and monitoring process. So it may not always be the compliance officer that's doing the auditing. It might be someone in a particular department that has a particular specialty or area of expertise that they're engaged to come in and help do that audit. And then they're also, or someone else might be designated to do that monitoring or that follow-up piece. So we want to make sure that there is documented accountability assigned so that the work that we're doing or the work that we intend to do doesn't fall through the cracks. And then ultimately, if there's any training or educational needs that are required for the employees or for that particular department, that's addressed at the organization as well. So really that's going back to identifying root cause, what was the breakdown, what was the gap, and then let's fix it at that point. Provide the training and education so that hopefully we don't see this issue arise again. So disciplinary guidelines should be clearly communicated at the organization to all employees and well publicized. And disciplinary sounds so negative, but it's important that when we have standards in place and we have compliance programs in place, that when there are violations that occur, that there is a disciplinary mechanism or a flow of what might happen. So if what I would like to see, or in most organizations, what we see is kind of an incremental disciplinary, and HR is usually actually a big part of putting this together as well. But outlining, is it, you know, a verbal warning, something in writing, and it's just the different level. It depends on the different levels of the violations as well. And so that should all be in writing as part of your disciplinary guideline policy and procedure on what exactly will happen if, let's say, it's a confidentiality issue, like a HIPAA violation. And was it intentional, or was it an issue where maybe something was faxed to the wrong fax machine? There's different measures that organizations have put in place when it comes to different things like this. And one thing that is extremely important with disciplinary guidelines is the consistency around it. So employees can see and the employees know when things happen, especially in smaller organizations. Everybody kind of knows. And so if they find that somebody did something and it was reported, but then nothing really happened, that's going to speak to the employees that, oh, well, I guess it's really not that serious, or we don't really have to take compliance as seriously as maybe the policy says that we should. So that consistency and really adhering to the policies and procedures that are in place are important for this area, and really establishing that culture as well. So the corrective action, we really kind of talked about this a little bit with the auditing and monitoring, but this is following up on things that have been reported, the suspected violations, doing that investigation, determining, is it an issue, is it not an issue? If it is, what are the actions that we're going to put in place to ensure this no longer continues? And those preventative pieces as well. So outlining the action and then ensuring that it's prevented from happening again. Utilizing data and reports to follow and find trends. So maybe it's something that you can run a report from a denials perspective to see, okay, are we still using that code? Are we still getting this error message? Are we still getting these edits? Those types of things. So utilizing any data that you have at your disposal can help in this area. And also the corrective action should prevent the likelihood of reoccurrence. That's really like the main point of the corrective action, is ensuring that we stop the action and that we no longer have to deal with this issue. And again, this just goes in line with showing that commitment to compliant practices by putting corrective actions in place. Okay, so I'm going to talk a little bit about the risk assessment process. And I do want to reiterate what I went through is, it seems like a lot. There's 7 elements, an 8th element, there's risk assessments, there's work plan development, and seems like that's a full-time job in and of itself. But we know it's not realistic that some of our organizations have an individual that is solely responsible for compliance. And they might be also responsible for quality, or maybe they're the HIM director. There might be some different roles that they play. And so what I will just say, based on the first 7 elements that we've just talked about, it sounds like there's a lot of work, but if we do that work up front, get our policies and procedures in place, outline our program, have a lot of these documents updated, then going forward, it's just maintaining that program. So it might be where there's a little bit of work or a lot of work up front, depending on what you have in place. But then once it's established, now it's just a matter of keeping it going, the maintenance and the updating of policies and procedures on an ongoing basis. So I'm going to kind of switch to risk assessment. And the risk assessment process, I will say, is it's a once a year type thing. It's not something that needs to be done multiple times a year. And in fact, how involved the risk assessment is also going to depend on the size of your organization. So basically what the risk assessment does is helps to determine the areas of highest risk at the organization. And we know that there's publications out there, there's the OIG work plan, and we'll talk about that as well, but there's tools that we can use to know, well, what's the industry looking at as far as risk, but then what about risk specifically to our organization? Identifying these risks can assist with the development of the annual compliance plan. And this risk assessment is really focused on staff feedback, interviews with individuals that work at the facility, and what their perception is of risk at the organization. Again, there's the OIG focused areas. There can be RAC activity that's specific to your organization that might come into play. How about prior audits that have been conducted? So if you've been audited by Medicare or another agency, what did those results show? And that might be an area that you want to include as part of your risks going forward that you want to keep an eye on. And again, this is all going to assist with that annual compliance plan development. I do stress that we need to allow for some flexibility when it comes to the program development or the annual plan development, because sometimes you might have some new services that are being provided. There might be an area of growth of the organization. And so we want to allow for time and opportunity to address those risks, as well as the ones that we already know about through the risk assessment. This is just a very, I guess, condensed version of a sample risk assessment. So one thing that would happen maybe during an employee interview is asking them to describe the risk in their mind, in their eyes. What is the risk to the organization? And they might say cybersecurity. And then in their eyes, what do you think the impact to the organization would be? Well, there'd be impact to the patient. There would be possibly fines and penalties, which would then lead to financial risk to the organization. And then we ask, well, what do you think the likelihood of this happening, of this occurrence would be? And they might say, well, I think it's pretty likely. I think it's between 65 and 90%. And again, this is just an example of one of the matrices that we use. And then we talk about, well, what does the organization have in place already that's trying to mitigate this type of risk? So maybe there's some controls in place. Maybe there's been the implementation of multi-level authentication. Maybe there's some other things the organization has done to ensure security. So then what is the leftover risk or the residual risks now after we look at the mitigating activities that are being performed at the organization? And then that kind of guides us to, well, where do we want to put this risk on the priority scale? There's additional columns that would be a part of this, such as who's the risk owner, and that could be the department, it could be an actual individual. So there's different pieces that can be added to the risk assessment, but these are kind of the core questions that we typically go through with employees when we're talking about their perception of risk at the organization. So one of the things that's probably always a big question is, well, if we're going to do something like this, how many people should we interview? And I really do think that that is resource driven as well as size driven. So a smaller organization, maybe your interviews consist of 10 people. Maybe at a larger organization, you're interviewing 30 people. So that's really a determination of the organization on what do we, based on our size and the services that we provide, how many people should we interview? And that interview list should really include a variety of positions that are held, variety of staff employees. So you might have some providers in that mix, maybe some clinicians, maybe some coders, billers, maybe it would even include people that are involved with maintenance. So we really want to include a good cross-section of individuals to really understand what they're looking at from their lens when it comes to risk. And then you choose a criteria. The one that I just shared is just an example. There are many different ones that can be utilized for a risk assessment. And those different tools will give you the ranking system that you may or may not want to use that might fit for your organization. And then the time frame. These interviews are not long interviews. They're typically 15 minutes. So let's say that you're a smaller organization and you want to interview 10 employees. It may be that you block out a day for the interview process, and maybe the next day is compiling the results and working through that work plan. So we don't have to make these long, drawn out interviews. They can be brief, and we can get 2 to 3 different risks covered within 15 minutes. So we can try to keep it very manageable. So once you have your risks, we'd like to organize them into buckets. And some of the buckets that I think of are compliance, quality, security, operational, and we sort them that way. And then we start looking at the rankings. And that really comes from that residual risk category on, well, what is this risk level to the organization based on the mitigating activities and the other pieces that we put in place to try to prevent this risk from actually occurring at our organization. And then once all of this information is compiled, then we start looking at, okay, well, what can we feasibly do as an organization to actually tackle these risks, do an audit around some of these risks. You may pick the top 5, and that might be part of your annual work plan based on the likelihood of it happening, based on the risk to the organization, based on the OIG work plan. There's a lot of different factors that might make that particular risk be #1 priority versus something to be like number 30 priority. And we develop the work plan based around that priority list. And we want to make that work plan realistic and doable for the organization. And once that's all put together, then that plan goes to approval to the board. So I kind of talked about this already, but those resource considerations, and sometimes it may be that for a one-time, several week period of time, maybe you do need an external resource to come in and help with the risk assessment and putting together the work plan. And then from that point, you're able to take it and run with it and perform that work throughout the year internally. We work with organizations that have all levels of staffing. And so it might be that you engage with an external resource to use on an as-needed basis to help with an audit, or like I said, just to help with the risk assessment and use them on an as-needed basis. Some organizations outsource a vast majority of it because they really just don't have staff or a department to address some of these compliance concerns. And other organizations might have an entire compliance department that's fully staffed and able to do everything internally. So it really needs to be unique to the organization, and those resource considerations are a big part of this. And then that matrix approach is really going to drive what ends up on your work plan. And that's going to be the type of risk, the likelihood that it's going to happen, that impact to the organization. And again, what's the actual residual risk after you look at those mitigating factors. So we've probably all used SMART goals at some point with some work that we've done, but this is a good way to just focus on the actual plan and what is doable, what can we accomplish in our annual work plan, and ensure that we can that it's realistic and that it's, we don't want to put 25 things on a work plan knowing that, well, we're probably only going to get to 5 of them. We really want to make it doable and capable of being achieved. So this is just one example of a way to kind of go about setting those goals and ensuring that we're not overextending ourselves. So I just wanted to include, again, kind of a scaled down version of a compliance work plan. This would be like the annual compliance, I guess, action plan, so to speak. And so maybe it's the year that we need to do policy and procedure update, and we schedule, okay, we're going to make sure that gets done in Q3. Who's owning that? It's the compliance officer. And additional columns could be actual individuals, the actual deadline, and then also maybe a status update. And this can be used when you are reporting at your compliance committee on a quarterly basis. There might be a diagnosis coding review that's part of the annual work plan. Maybe this is done quarterly, and I'm just using an example of 10 patient records per quarter. It might need to be more at your organization depending on your size. I included pharmacy services because we know that that's something that the OIG does look at is medication error rates. So there could be an audit around that as part of your annual plan. And again, there would be additional columns to add deadlines, status updates, and those sorts of things. So measuring program effectiveness, I will say, probably seems the most vague or ambiguous or more difficult element of the compliance program, because how do we know if we're being effective? If we don't have any issues or all of our audits come back with stellar results, maybe that means that our program is effective. Well, one thing I want to mention is that the OIG has a really great resource. I've included the website here. It's a large document. It's over 50 pages, but really it breaks down the 7 elements of an effective compliance program, and it pretty much creates a checklist for you to go through and assess, okay, do we have this policy in place? Do we have this code of conduct in place? Do we have a hotline set up? Do we have a mechanism for communication and reporting? Do we have signs throughout the organization that are speaking to compliance? Does everybody know who the compliance officer is? Those are just some examples that are on this document. And I like it because it's really almost designed, even though it's to measure effectiveness, it can also be used on the front end as a checklist to see, okay, well, what are the gaps that we have in our compliance program? What are the areas that we need to update or put in place that we don't currently have in place? So you could really use it as an assessment internally for yourself, and then work towards filling in those gaps. And so this really is twofold, in my opinion, kind of like an internal auditing tool, as well as measuring that program effectiveness. So some of the challenges that we face around effectiveness is really going to be culture. Do we have board and leadership buy-in on compliance and the need for compliance, the need for a compliance officer? The things that I just mentioned in that OIG document, do they understand and realize the importance of all of those elements? Is there a clear reporting structure for the compliance officer where they've been given the authority from a compliance perspective, and they also have that dotted line reporting structure directly to the board? Are there any systems or data limitations when it comes to getting data, looking at trends, identifying denial situations, even just pulling to see what is the utilization for a certain type of procedure or a certain type of diagnosis code, because maybe that's a focus of the OIG and we want to see, well, is that something we're even doing? And so are you able to pull information to help you identify any concerns? And then I think one of the biggest ones is resources, because let's face it, this takes time and it's challenging to get some of these pieces and parts in place, but it really should be a leadership effort and a team effort to put the compliance program together, with that compliance officer, of course, kind of, leading the train on that. But it's looking also at, did we give that compliance officer enough time aside from their other duties to put into compliance? If not, do we need to obtain some external resources? So resources can both be from a personnel perspective and also from a financial perspective. So when we see success in the program effectiveness, it's usually because we see a lot of leadership engagement. We see a message from the CEO about compliance. We see the board being engaged in the compliance committee. Another thing is having tools such as graphs and charts. A lot of times it's the visual itself that can really speak to the compliance committee or even others in the organization. When we found an issue, are we able to then put it into a format that would speak to them? A lot of times I see that providers really like to see graphs and charts and things like that so that they can visualize what the issue might be. And are we also engaging an external resource to do assessments? That's one piece that the OIG has also stated, is doing a periodic assessment of your compliance program from an independent source. So that would be an evaluation from an external vendor to come in and take a look at the policies and procedures, go through the 7 elements of compliance, give feedback and recommendations on areas that they find that could be enhanced, or maybe gaps that they've noticed that that really don't have what they need around that particular element. And then ease of access for the employees. Do we have a way for them to look at the compliance policies and procedures and find them easily? Do they know who the compliance officer is? Do they know how to get in touch with that person? Do they have access to the hotline? Do we have that information posted throughout the organization? Maybe even a compliance newsletter might be something to consider on a quarterly basis, just to kind of keep that conversation around compliance fresh in all of the employees' minds. So here's some OIG focus areas that I did want to touch on that are specific to the senior living space. So the work plan used to be developed by the OIG on an annual basis, and we would go out and look at that work plan once a year and pretty much know it was going to stay the same unless there was something drastic that came along. And now they update this work plan on a monthly basis. So it really needs to be monitored every month to see, well, what is new on the work plan? What are some things that I know that the OIG is focusing on? Is it something that pertains to my organization? Does it not? And making those decisions. So some things that are current on the work plan right now that would pertain is the use of provider relief funds, the eligibility and the supporting documentation around those, the use of telehealth during the pandemic. And I just want to make a comment about that there was a recent audit that was performed where 96% of claims had some sort of an error when it came to telehealth. I don't know the details of what exactly the errors were that were found, but that's just something to know that's an area that's being looked at. And then meeting the challenges of COVID-19 specific to nursing homes is on the OIG work plan. Reimbursement from a PDPM perspective, and then conducting background checks on employees in the senior living setting. So this would be ensuring new hires as well as performing those monthly sanction checks. So I'm going to actually turn it over to Jessica to talk a little bit more about some of these specific compliance areas and hot topics.
Thank you. So yes, like Rachel said, I'm going to go a little further into a few of those clinical compliance pieces. And first off with PDPM, we're a couple years now into the implementation of this, but there are still some facilities that are not entirely comfortable with it and are still working out all of the bugs a little bit. But what I've seen many times with this new system is that the diagnosis list is not current or not updated as it should be. Part of the piece of compliance for this is looking at those codes and monitoring that there is a diagnosis code for every PDPM group and that they are approved by the provider. So when you're getting admit paperwork, ensuring that that diagnosis list is there and that it's accurate to the resident needs. Specifically, an example is, if a resident has speech therapy needs, is there a diagnosis that relates to this and is it listed and approved? And does that documentation in your medical record support that diagnosis and the care that they are receiving? At admission, again, this patient information should be thoroughly reviewed to capture any and all applicable supporting information so that you have that right up front to help develop as you go through your documentation. All this information pulls into the MDS. And so if the MDS is incorrectly coded, there's potential to miss out on a higher reimbursement maybe for the care that you are providing for that resident. If it's not there and your staff are doing it, you might not be getting that reimbursement. I say that a lot to the staff with education that, it's a 101 rule. If it's not documented, it doesn't count, it didn't happen. And so ensuring that everything that we're doing for a resident is getting entered into their medical record. If there are conditions or cares that are provided or not provided and are reported on the MDS, that also opens up for potential for recoupment, I should say, for payment. And so again, it goes both ways there, but I also ask staff, if I were to open up a medical record for a resident, would I be able to read from the time that they woke up to the time they went to sleep and through the overnight what they did with their day? Because all of that information should be there. That documentation should really paint a picture of what happens each day for each resident. And then looking at documentation, audits, and monitoring, providing staff education for the frontline staff, especially immediately when there are concerns noted so that it doesn't snowball into errors and misdocumentation. Casper reports for any errors then when MDSs are submitted. When you submit your MDS reports, the Casper system should pop back out a warning if there are any errors noted. Quality reporting requirements are pulled from the MDS data when it's submitted. So there is a warning when submitting that impacts quality assurance measure. You'll get a notice of that, and not addressing this could mean financial impacts in the future. F-tags. So if you've ever been through a survey, you are aware of what a F-tag is. These are requirements that all providers must be compliant with. No surprise here, but after last year, infection control is definitely a survey hotspot, and it'll probably continue to be going forward. And so it's important that you have an infection control program in place and an identified infection preventionist, someone who is responsible for monitoring and implementing any requirements and maintaining that program. At this point, I'd hope that most providers have this down, but continuing to stay compliant then and not letting it slide is going to be important. Immunizations are another focus area, ensuring that there is documentation of the immunizations for residents in the medical record, and then obtaining that information if it's unknown at admission and getting that updated as soon as possible. With nutrition, it also kind of ties to infection control. But ensuring that all food items are labeled with expiration dates, including snacks that could be kept at the nursing units. If you allow your residents to have personal refrigerators, they need to meet the life safety requirements, meaning they need to have the proper outlets and should never be plugged into extension cords or anything like that. There also needs to be a policy for addressing when outside food is brought in for a resident. If a family or visitor is bringing in food, how is that going to be monitored to ensure that that resident isn't eating expired food if it's kept in their personal refrigerator, and that it's not left for someone that could maybe be a potential for a choking risk. On that note of policies, they are a big part of compliance, and even more so, it's important that what is stated in those policies is what's actually happening. And so this is important during those policy review times to review if they are if the policy is stating what is actually happening, and if it's not appropriate or applicable anymore, making sure that those get updated when those policies are reviewed. With pharmacy services, we are reviewing and addressing medications for each resident to decrease or discontinue any medications that are no longer necessary. How many medications are prescribed as to help with side effects of a different medication, and then that other medication is no longer needed, but the one that was prescribed for the side effects still on the medication list hasn't been addressed. So working to remove the ones that are no longer needed. And so this is a good place for the interdisciplinary team to discuss what's necessary and what's appropriate, and then to request for that provider to discontinue it if it's not needed, or even trial it if possible, if we're questioning if its purpose is necessary anymore. Also ensuring that antipsychotic medications are being discontinued when possible, monitoring and documenting attempts to decrease dosages when medication is still deemed necessary, but working to decrease it as much as possible, and preventing medication errors. And sometimes this can help be achieved by decreasing the number of medications a resident is taking. When we look at resident assessments, we're ensuring that they are accurate, coordinating the assessments between the MDS nurse and the staff who might help complete these, and then monitoring and updating those care plans to make sure that they are an accurate reflection of your resident. For quality of care, we identify those potential risks within the facility. Are we looking at hallways to ensure that there's no obstructions, or if there's flooring that's lifting, that we're addressing it immediately to prevent falls? And then documenting that it was addressed and what was implemented to mitigate that potential risk. And I've heard numerous times that documentation is the most thorough during, quote, MDS week. But best practice would be that documentation and resident assessments continue even when outside that MDS window, just to make sure that all the care provided to the resident makes it to the medical record. And it allows for trending and looking for any potential tracking of concerns and things that maybe the staff are witnessing, but it helps back up and support their concerns as well. So what do we do next? We go through the 7 main elements of compliance and determine your gaps. Utilize the effectiveness checklist that Rachel mentioned back on slide 22. And use this to mark off the things that you have in place and then highlight the areas that you need to update or implement. As part of that checklist, review the documents that you have in place and the dates that they were last updated. And utilize free resources. There is a membership fee associated for HCCA and SCCE, but there are free resources within their websites that can be accessed. And the OIG will always be a tried and true resource, and everything on their website is free. So with that, any questions?
Any final thoughts?
Yeah, I think one of the questions that I probably get the most is how to manage compliance and the responsibilities around compliance when I'm also responsible for an entire additional department. And that's part of, you know, the work that I do. I wear multiple hats and that sort of thing. I can't say that I have some easy answer on how to make that work, other than just really comes down to carving out time for compliance. And I know that might mean that some other work in some other areas might be a little bit delayed, but especially when it comes to like things that you know you can schedule, like an annual policy and procedure review, carving out time on an annual, or maybe it's an every other year structure that you have at your organization to review policies and procedures. Have it on the calendar that this is the day that we're doing this. These are the individuals that are going to help with it. And we schedule it and kind of knock it out at that time. Kind of the same thing for the risk assessment, carving out time and scheduling it, and just dedicating specific points in time throughout the year that compliance is going to be the main focus, and some other things are just going to wait. Now, of course, there's going to be things that are unexpected and that pop up in maybe in both jobs that you hold a position in, and that will take your time away from compliance, maybe even if you had a time scheduled for it, or vice versa, where there might be an investigation or an audit that took place that was unexpected. And those things are understandably going to happen, but I think at least trying to be a little bit proactive on the front end to schedule some things as much as possible, knowing that that schedule might flex a little bit and change somewhat, but at least there is that knowledge and that attempt on the front end to schedule that time for compliance, and really, of course, communicating that as well to leadership in the organization that, okay, these are the dates that we're doing policy review, these are the dates for the risk assessment, so that everyone knows that this is the time that we're dedicating to these compliance functions. Thanks everyone for your attendance today. We appreciate it.
Thank you.
Perfect. Thank you, Amy, Jessica, and Rachel for presenting. Thank you all for attending. Have a great day.